wild animals. So starting at the very first chapter of this digestive system, as we have already talked about the mouth cavity, in which there are so many inflammatory lesions will be there. That is the part of stomatitis. It is almost like the inflammation of any part of the oral cavity. It may be due to chemical and it may be due to physical. Mostly physical injury is there, and so many etiological agents like the FMT, like the vascular stomatitis, like the canine distemper, like the other diseases that has an effect on the oral cavity, that forms a lesion in the mouth. ठीक है, चाहे वो टंग में, चाहे वो लिप्स पे, चाहे वो गम्स में प्रॉब्लम करेंगे, that is a part of stomatitis, when inflammation of the oral cavity. Whenever there is inflammation, either it may be due to chemical or due to physical, the animal will salivate. In the previous class, we have talked about the stomatitis, in which the animal salivate. And most of the time, as a doctor, we are so much concerned with rabies that we think that it is a case of rabies. But always keep in mind, it might be a case of rabies. We are not ignoring the case of a rabies in case of either a small animal or large animal. We have to take precaution. We have to wear gloves. We have to take the protective mechanism when the animal is salivating highly. But at the same time, we have to diagnose the case, whether it is a case of stomatitis, whether it is a case of some other infectious agent, or whether it is a case of high rise of body temperature or hyperthermia. As you people are already in a general systemic state class, and I think Dr. Bipin sir has already taken a class on temperature, pain, and inflammation, as well as on fever and toxemia. So many classes are there in general systemic states. So we have to make a differential diagnosis. Only on the basis of that the animal is salivating, we cannot say that it is a case of either stomatitis, or it is a case of pharyngitis, or it is a case of laryngitis. We have to make a differential diagnosis, and therefore I am starting this class, the pharyngitis, that is after stomatitis, because we are dealing the gastrointestinal tract from the mouth, oral to a boral region. We have started from this region and we will end in the rectal region, from where the animal passes the feces. So coming back to the second part, that is the pharynx, and the inflammation of this is called pharyngitis. So it is the inflammation of pharynx, simple one, but our role is how to diagnose. There will be minute differentiations when we talk about pharyngitis, when we talk about pharyngeal obstruction, when we talk about pharyngeal paralysis. All of them in initial stage appears very, very similar in clinical signs. Only our role is how to diagnose, how to make a differential diagnosis. So it is the inflammation of pharynx. It is the inflammation of pharynx, as we have already seen, and how the inflammation of pharynx is characterized. So what the clinical sign you will find. So whenever there is inflammation, especially from stomatitis to the lower region of the GI tract, the animal will start coughing. So this will be the first complaint of any owner. My cattle is coughing, dog is coughing. You have, so first sign, and this coughing is such a common sign that once the owner complained that my dog is coughing and cow is coughing, you write a prescription, you take a paper and write a prescription that it is a type of respiratory problem. So first you have to make a diagnosis, whether this coughing is due to pharyngitis or whether this coughing is due to some respiratory problems. Because in both the condition, you will be getting the sign, you will be getting the symptoms of coughing. So this is the first sign you will be getting. Then painful swallowing, as we have discussed in the previous class also, when we suffer from some running nose, सर्दी से जब हम सफर करते हैं, पहले दूसरे दिन हमको कितना दिक्कत होता है जब हम पानी पीते हैं, जब हम खाना खाते हैं, we feel some pain in this region. And certainly whenever there is a pain in the oral cavity, the animal will show variable appetite. This very, sometimes it stops feeding also, sometimes there is a loss of appetite, and sometimes there is regurgitation through nostril or drooling of saliva in severe cases. So these are the very, very important cardinal signs you have to take in mind. Variable appetite is common, it may be in any disease, but regurgitation through nostrils and drooling of saliva, means excessive salivation in severe cases, is one of the indication of pharyngitis. As we have talked in stomatitis, again here, the two very important etiological agents, that the first one is the physical and the second one is the infectious one. In physical, there is a, sometime you might have seen in the village condition, people used to give certain medication, certain feeding, certain things with the help of a drenching gun. They make a drenching gun of their own, of a bamboo. आपने देखा होगा बांस का एक बना करके ऐसा नोकीला सा कुछ पिलाने के लिए उसको रखते हैं, कुछ उसको मोटा करने के लिए, कुछ दवा देने के लिए, and that's create injury if it is in sarper. So this is accidental injury to this oral region. Whenever there is oral injury to the pharyngeal region, the animal will show pharyngitis. So during treatment or during endotracheal intubation, sometimes the doctor, sometimes when you try something to relieve some other problem, you create some other problem. So in that condition, especially during endotracheal intubation, if you are not lubricated the region properly, or if you are pushing the tube harshly, then it may create some injury in that region. Or sometime by accidental ingestion of some of the irritant or very hot or very cold substance. This is generally occurs in small animals. They accidentally ingest, or you give some hot thing to the animal, they are unable to discriminate, then they start taking it, उसको ले लेते हैं और उसको यहाँ पे कभी कभी आपने देखा होगा जैसे कि आप एक चाय पी लिए गरम सा और आपको फील आएगा कि आपने बहुत गरम ले लिया, उसके बाद 1-2 दिन तक आपको फीलिंग आएगा कि मैंने गलती से गरम पी लिया था, इसके कारण ये डेवलप किया है. But there are, in case of cattle, there are foreign bodies like cereals, where when they eat something, they are unable to discriminate between the sharper object and the grass, especially small wires, small bones, and generally are present in their feed, and that creates injury in this region. So these are some of the physical agents that created injury in this region. It will be common in stomatitis also, in pharyngitis also. Whenever the question comes, you just write the common thing. Then the second very important thing is the infectious cause, that is some of the bacterial and the viral agent. For example, actinobacillosis is there, infectious bovine rhinotracheitis is there. So these are some of the necrobacillosis, oral necrobacillosis is there. These are some of the bacterial agents that are responsible for producing inflammation in that region. And then intramedular cellulitis by Fusobacterium necrophorum. So some of these are the bacterial agents that created the infectious agent, जो infectious agent है जो कि responsible है इस region में inflammation करने के लिए. Now coming to the most important thing, the clinical finding. Whenever the animals suffer from pharyngitis, they refuse to eat and drink. They're swallowing. When you will observe, we have 2 cases here. I will show. We have made a recording of that. They are suffering from same type of symptom. I will, in the next class, I will incorporate a recording in which you will able to appreciate how pharyngitis, how laryngitis, how you will differentiate, how animal regurgitate. I have a picture of a cattle. Whenever it swallow its foods and then reverse back that food, so you will be able to appreciate how regurgitation can occur in a cattle. So swallowing will be difficult. You can observe in the region how difficulty there is in passing of the food from this region. There will be something visible in this region. So pharyngeal coughing is there on compressions. Whenever you go to a doctor with a chief complaint of coughing and chief complaint of sneezing and coughing or cold, they used to ask to show your tongue. They used to palpate in this region, that is in the pharyngeal region. So in cattle also, in a small animal also, whenever you press on this region and you compress on this region, there will be paroxysmal coughing. The animal start coughing. Okay, so this is one of the signs that there is inflammation in this region. But in case of severe regurgitation of fluid, but if that inflammation is very, very severe, there is a chance of regurgitation of fluid and the food material from the nostril also. Whenever the animal start taking food and when they start taking swallowing as the food, there is a severe pain in this region, and in that condition, they regurgitate the food from the nostrils or from the mouth cavity. And the third very important point, the drooling of saliva. with tentative jaw movement. So this is very, very important cardinal sign, drooling of saliva with the jaw movement. Now, how you will diagnose this type of cases? First, the method of diagnosis, as we have discussed in the initial practical class, to how to diagnose a case. Three very important method I have told, that is physical method of examination. One is palpation, second is percussion, and third is auscultation. So the second very important method, the acute pain can be evidenced either by palpations or by passing some endoscopic examination, which is very difficult to see in this region. So by endoscopic examination or by with the help of a mouth gag, when you open the mouth and then you put a probe in that region, you will be able to appreciate the inflammation in that region. But after diagnosis, how you will go, I actually in treatment, I will talk more because I have written less here, and you have to refer book also, because treatment is almost similar, whether I am talking about pharyngitis, whether I am talking about stomatitis, means any type of inflammatory condition of the GI tract. So your first line of treatment is, first we have to treat the primary cause. So for that, we have to diagnose the primary cause, whether it is physical or whether it is some infectious. If it is physical, you have to remove that foreign body. Suppose some on is there, कोई कांटा है, कोई वायर है यहाँ पे फंस गया है, और आप बिना मतलब का एंटीबायोटिक चला रहे हैं, बिना डायग्नोसिस का, अपने माउथ कैविटी को ओपन करने का कोशिश, उसको देखने का कोशिश नहीं किया, उसको फील करने की कोशिश नहीं की, और आप एंटीबायोटिक चलाते रहिएगा, एंटी इंफ्लेमेटरी चलाएंगे, हो सकता है आपको रिकवरी नहीं मिलेगा वहां पे. So in case of physical injury, especially if there is certain foreign body embedded in the cavity, so you have to remove that case. Otherwise, if inflammation is due to some chemical or it is due to some of the infectious agent, you have to treat it with the fluid therapy. You have to treat it by anti-inflammatory drug. We will discuss in, you might be discussing in VCP class also, the different types of anti-inflammatory that act on the GI tract, because so many anti-inflammatory drugs are there. They have a role of analgesic, antipyretic, and anti-inflammatory. You have to choose one of them that acts is more anti-inflammatory. If the fever is there, you have to give anti-inflammatory in combination with antipyretic. So there are medication that has all the three roles. You have to choose whether it is more anti-inflammatory, and then with the anti-inflammatory, antipyretic, you have to give a non-steroidal anti-inflammatory drug. With that, with the specific antibiotic or the broad spectrum antibiotic that acts on the oral cavity. So that is very, very important. You have to give antipyretic drug, you have to choose antibiotic, and at the same time, you have to make the mouth cavity lubricated so that there is soothing agent, because the animal, if there is no soothing agent in the mouth cavity, the animal will be unable to take them out. There will be feeling of pain in the oral cavity, and in that condition, animal will not recover quickly. So the three intake here from this, that you have to treat the animal with the help of NSAID, non-steroidal anti-inflammatory drug. You have to lubricate the mouth with glycerol or any other lubricating agent, or then you have to give one antibiotic. And if at all, if the animal is not taking food, you have to go for the fluid therapy, because until and unless you give the fluid therapy, the animal will not recover quickly. If some owner say that my cattle is not drinking water from last 2 and 3 days, if the dog owner is also telling us and this animal is not taking water, so at the same time you have to go for the fluid therapy. So this will help in recovering the patient faster. Now coming back to the similar type of situation, whether first I have talked about the inflammation, and then I am talking about the more acute condition called pharyngeal obstruction. Okay, so this is related. ये पिछले जो बीमारी था उससे ये बीमारी का रिलेशनशिप है. Pharyngeal obstruction है यहाँ पे. ये सीधा सीधा इसका कंसर्न सर्जरी से भी हो सकता है, but as a type, first as a diagnostic part of view, you have to make a differentiation. So as the name indicates, the pharyngeal obstruction, it is the obstruction of pharyngeal region accompanied by stress respiration, coughing, and difficult swallowing. The same thing is there. Just a few 1 degree or 2 degree difference is there. Here, because there is obstruction in this region, there is difficulty in respiration also. So just take in mind, in the previous, I have not talked about the respiration. Here I am talking of the respiration that is difficult respiration. Strenuous means typically there is some effort is needed for respiration. That is called a strenuous respiration. Coughing here also very, very important. And if it is a partial obstruction, there will be difficulty in swallowing. So there will be difficulty in swallowing here if it is a partial obstruction, but if it is a complete obstruction, the animal not at all taking food inside the cavity and the food will regurgitate from the mouth cavity. So etiology, again, the etiology will be foreign body or swallowing. Here, as I have talked in the previous, the etiology was physical as well as chemical. But here I am talking of the foreign body or the swallowing, means swelling in this region. Suppose this is a pipe, and if there is some roundish object or some object is there in this, there is obstruction, or if there is some swelling from the outer region, some lymph node swelling is there from this region, then it will compress this region, and again this lumen will be shortened. So in that condition also, for example, the inflammation of retropharyngeal lymph node, that's this lymph node inflammation occurs in so many infectious diseases, especially in case of tuberculosis also. So due to the inflammation of the retropharyngeal lymph node, foreign body or swelling, that there will be difficulty, and that may lead to obstruction. So pathogenesis, difficulty in swallowing and respiration. So two very, very important pathogenesis from the previous one. There is difficulty in swallowing and difficulty in respiration is the one of the signs that it may be a case of pharyngeal obstruction. Now, clinical finding, as we have talked in the pharyngitis, coughing of food through the mouth. Here, the animal will cough food from the mouth. Initially, we have talked about the salivation also, similar excessive salivation, drooling of saliva, but here the food is coughed out from the mouth. Little and no regurgitation through nostril, because there is obstruction in this region, the food is coming out from the mouth because the food is not passing down, and then it is not coming out from the nostrils. So if the animal is regurgitating through the mouth cavity, you must suspect it might be a case of pharyngeal obstruction. So sometimes drinking usually normal, and there will be difficulty in respiration, and you will feel the sound of a snoring respiration, just like a खर्राटा मार करके जैसे सोते हैं, उस तरह का sound आपको दूर से सुनाई पड़ेगा. But again, I am warning here, there are other disease also. So my question is, which is one of the disease in which you will be getting a sound, snoring sound in case of cattle and buffalo? It's a parasitic.
सिस्टोसोमा के इन्फेक्शन में, सिस्टोसोमा इन्फेक्शन में.
सिस्टोसोमा क्या?
नेजल ग्रेनुलोमा में सर. नेजल ग्रेनुलोमा में सर.
ओके, कोई केस देखा है आपने सिस्टोसोमा का?
नहीं सर, केस नहीं देखे हैं, सिर्फ पढ़े ही हैं, थ्योरेटिकल.
ओके, ठीक है. तो हमेशा ध्यान रखना है कि ऐसे नहीं कि मैं बता रहा हूं, अगर आपको स्लोनिंग रेस्पिरेशन आपने गांव में या कोई कैटल को पहली बार देखे और तुरंत आप डिक्लेयर कर दिए pharyngeal obstruction है, ठीक है? So you have to make a differential diagnosis. And how you will make a differential diagnosis from Schistosoma nasalis and pharyngeal obstruction here? आपने पढ़ा होगा पैरासिटोलॉजी में.
कॉलीफ्लावर लाइक ग्रोथ होता है सर, उसमें कॉलीफ्लावर लाइक ग्रोथ.
कहाँ दिखाई पड़ेगा? कॉलीफ्लावर लाइक
नॉस्ट्रिल में सर.
नॉस्ट्रिल में. और कोई कार्डिनल साइन आएंगे? कुछ आएंगे कोई कार्डिनल साइन? एक बहुत अच्छा कॉलीफ्लावर लाइक ग्रोथ होगा. स्नोरिंग साउंड सुनाई पड़ेगा, जो कि दोनों में सुनाई पड़ सकता है. यहाँ पे आपको डिफरेंशिएट करना है. क्लिनिकल अभी हम पूछ रहे हैं, अभी हम टेस्ट पे नहीं जा रहे हैं. There might be blood is oozing from the nasal cavity. खून गिरेगा, epistaxis होगा, ठीक है, अगर ग्रोथ इतना ज्यादा हो जाएगा. और भी फिर अब जब हम डायग्नोसिस पे जाएंगे तो हम उसको चाहे तो उसके नेजल जो स्वाब है उसको लेंगे और उससे हम स्मीयर बना करके देख सकते हैं किस तरह का शेप एक का दिखाई पड़ता है स्लाइड में. बहुत ही peculiar है,
कलर
बहुत बार
पाइप
क्वेश्चन
स्टीम
आया।
सर, कलर पाइप स्टीम।
कलर पाइप स्टीम। और कोई दूसरा नाम?
कलर,
कोई दूसरा नाम? कोई हैट की तरह होता है, टोपी के तरह?
नेपोलियन हैट। नेपोलियन हैट।
ये सब आप याद रहना चाहिए, ठीक है ना? आप क्लिनिशियन बनने जा रहे हैं, आपको फटाफट अब ये सब आप याद रखिए। जो आप उधर पढ़े हैं यहाँ पे प्रैक्टिकली आपको दिखाई पड़ेगा, वैसा केस आएगा, ठीक है? तो ये याद रखना है, स्नोरिंग रेस्पिरेशन। नाउ अगेन कमिंग बैक टू द ट्रीटमेंट, बिकॉज ट्रीटमेंट पार्ट इज रियली is the real challenge for the clinician. Sometimes we diagnose a case and sometimes we fail to recover a case at a very later stage. So your first aim is, if it is a case of obstruction, if you have diagnosed a case of obstruction, removal of foreign body is the first line of the treatment. Otherwise, by giving certain antibiotic, and NSAID is not going to help the patient. So removal of the foreign body, reduction of the swelling. So if the foreign body is removed, it has certainly produced inflammation in this region. And during removal also, there might be injury in that region. So you have to treat the swelling in that region. And then the very important line is written, parenteral treatment. Now, what is parenteral treatment? This is a very important line because you have to decide this decision you have to make whether we go for oral treatment or whether we go for intramuscular or intravenous treatment. Now, line is that if the animal is suffering from severe pharyngitis, even severe pharyngitis, or if the animal is suffering from obstruction, if you go for oral treatment, it is useless sometime, and it may create problem, because sometimes passing of a small bolus also create injury in this region. So you have to give rest to this oral cavity. For that, you have to choose a parenteral treatment, because once when to treat the parenteral treatment, then it gives rest in this region. Whenever there is a rest in this region, then the animal starts recovering faster. So you have to give intramuscular injection. You have to go for fluid therapy if it is suffering from dehydration also. So choose the parenteral treatment, both in non-steroidal anti-inflammatory drug, antibiotic, fluid therapy, or any types of vitamins, what you want to give. So this will help in recovering the patient faster. So always keep in mind, if the animal is suffering from inflammatory condition in this oral region, or in the pharynx, or in the esophagus, do not go for, you just like to prefer, do not prefer oral treatment. Go for parenteral treatment, because if you go for parenteral treatment for 4 to 5 days, then the animal will recover faster, because it provides rest and soothing to this region. So this should be kept in mind. So parenteral treatment with antibiotic, parenteral treatment with anti-inflammatory, parenteral treatment with fluids and electrolyte therapy, and with vitamin B complex is the line of the treatment for this type of cases. Now, I think I will cover this. This is the third, because we are dealing with the pharynx, and we have talked the two very important disease. One is inflammation, second is obstruction, and the third very difficult, most difficult one is the paralysis, because you know the nervous system, it's very difficult to regenerate a nervous tissue that is supplied in this region. But we have, as a clinician, sometimes we face this type of problem because we have to declare it might be a case of pharyngeal paralysis. And the third very important things I'm going to tell here, in the first, there was drooling of saliva first. In the second, there was respiratory distress was there, and regurgitation from the mouth cavity. And here, there is a chance of aspiration pneumonia, coughing and aspiration pneumonia, because the animal is unable to control the food, because he is an animal, either male or female, it is a cattle or it's a dog, unable to control the food because the nervous system is not working. So pharyngeal paralysis is manifested by inability to swallow and respiratory obstruction. Again, here there will be respiratory obstruction will be there, because the animal is not aware of that. So etiology may be Peripheral nerve injury, the nerve that is supplying this region, it may get injured. In case of equines, guttural pouch infection leads to pharyngeal paralysis. Mostly it is caused by some trauma, as we have talked in endotracheal intubation or by passing of the stomach tube or pass karte hain usme aapne injury kar diya hai. But sometime also very important disease like rabies, botulism, African horse sickness, or due to some injury in the brain that is central in origin. So you just keep in mind, as we have talked, whenever the animal is salivating, I have never told that it is not a case of rabies. Just keep in mind, all salivating cases might be suspected for a rabies, but there are other diseases also that has to be kept in mind. Therefore, you have to examine the oral cavity. You have to go for all the tests based taking all the precautions so that you are not getting infected with a deadly disease. So it might be a case of rabies, it might be a case of botulism, it might be a case of African horse sickness in case of equines, or it might be a centrally origin, means the lesion is produced in the brain by some injury that's applied to this region. So pathogenesis is, there is inability to swallow and regurgitation, again because the nervous system is not working. Roaring due to laryngeal paralysis, some sound will come, and cut dropping. Now this is a very important cardinal sign I talked due to partial pharyngeal paralysis. What happens? Cut dropping is a technical term in which the animal pass some of the food from the mouth cavity during rumination or during regurgitations. It is different from vomition, because in case of ruminant, vomition never occurs. Just keep in mind, if the ruminant will vomit, the animal will die. So vomition is not present in ruminant. That is called, vomition is a technical term. If the food is coming from the stomach, it's called a vomition. This is one of the cardinal signs of a monogastric animal, not a polygastric animals. So polygastric animal regurgitate. Polygastric animal shows cut dropping. They do not vomit. This is very important sign. Never write vomition in case of a cattle. So if the cattle, if it's passing out large amount of fluid from, then the cattle will die. So there is a cut dropping symptom is there, and as I told, aspiration pneumonia, because the animal during passing out of the curd, unable to control the food, and sometimes the fluid and the fluids enters into the oral cavity, into the respiratory tract, and there is always a chance of aspiration pneumonia. So in that condition, the animal remain hungry because not able to take food, but there is no region in the stomach or in the abomasum or rumen reticulum. So animal feel hungry, and so coughing, dropping of food from the mouth, again regurgitation through nostril, salivation is there. Swallowing cannot be stimulated by external compression. So in the previous case, I have talked that if you palpate in this region, there will be paroxysmal coughing is there. But here it cannot be stimulated because the nervous system is not working. So this is the very important sign. So treatment, although we try for the treatment, of the pharyngitis inflammatory condition, because it's very difficult to examine a case of pharyngeal paralysis by any gadget like the endoscopy or by any other, because the nervous system is involved. So in that condition, the treatment is not very successful. We have to depend only on the nervine tonic. We have to apply some hot fermentation, local application of heat, and then the parenteral administration of food. Means we go for fluid therapy, we go for parenteral administration of fluid for certain period of time. And if it is not a complete paralysis of this region, paresis is there, certain cases can be recovered. So this is the parenteral administration of food is again very important in case of pharyngeal paralysis also. So thank you for today. If you want to have some question, you can ask.
Sir, nervine tonic sir?
Yes, nervine tonic. We will talk. अभी मैं सिर्फ दवा का पूरा नाम नहीं ले रहे हैं आपको यहाँ पे, क्योंकि आप पूरे जब भी आप आएंगे यहाँ पे तो सिर्फ हम लोग दवा का ही टॉक करेंगे, क्योंकि ये आप, लेकिन जब भी हम आप क्वेश्चन लिखेंगे तो आप पूरा लिखेंगे. हम जैसे नर्वाइन टॉनिक के बारे में बात कर लिए, तो जब भी आप पढ़े होंगे कि नर्वाइन टॉनिक्स में क्या कॉम्बिनेशन हो सकता है, सो दैट कंटेंट विटामिन B1, B6 एंड B12, ओके। साइनोकोबालामिन, मिथाइन को आप लोग ये सब पढ़े होंगे कहीं पे। सो नर्वाइन, दे एक्ट एज ए नर्वाइन टॉनिक, ओके। बहुत सारे ऐसे मेडिकेशन हम नर्वाइन टॉनिक यहाँ पे इसलिए लिखे ताकि आप खुद भी थोड़ा सा इसको पढ़ेंगे, कौन कौन से नर्वाइन टॉनिक मार्केट में अवेलेबल है, कौन से अभी यहाँ पे प्रिस्क्राइब हो रहा है, डॉक्टर्स चला रहे हैं। When you will come here, especially the B1 को हम लोग देते प्रीफर करते हैं, B1, B6 ट्राइवीवेट करते, बहुत सारे ऐसी कंपनियां हैं। मैं कंपनी का नाम यहाँ पे क्लास में नहीं लेना चाहता। आप यहाँ पे आएंगे तो आप देखेंगे कि बहुत सारे कंपनी हैं, हर का अलग अलग ट्रेड नेम होता है। आपको वो भी लर्न करना होगा कि किस ट्रेड नेम से अवेलेबिलिटी है मेडिकेशन का। अदरवाइज समटाइम आप कोई ऐसा मेडिसिन लिख दे जो अवेलेबल ना हो उसके प्रिस्क्रिप्शन पे, तो डिफिकल्ट होगा। वो आप यहाँ पे VCP पे आएंगे तो आपको लग जाएगा कि मैंने यहाँ पे कुछ जो बताया है थियोरेटिकली, उसका प्रैक्टिकल एप्लीकेशन आपको हम लोग के प्रिस्क्रिप्शन पे मिलेगा। तो नर्वाइन टॉनिक इज देयर, इट इज ओरली आल्सो अवेलेबल। यू सी इन ह्यूमन बीइंग दे यूज्ड टू टेक न्यूरोबियन, ओके। नाम आपने सुना होगा कि उसको न्यूरोबियन का टैबलेट खिलाया जा रहा है, बड़ा लॉन्ग थेरेपी चल रहा है। Similarly, here in case of animal also, we go for same type of treatment, and parenteral we prefer. If it is a small animal and it required a very, very long treatment, we may go for oral. But if it is not a case of pharyngeal paralysis, that is, in case of paralysis, there is always a chance of aspiration pneumonia. So in that condition, the animal may die if the animal suffer from aspiration pneumonia. So just we have to take care, and this is one of the rarest disease in which there is a very, very difficulty. We try with the help of fluid therapy, we try with the help of hot fermentation, we try with the help of a nervine tonic. We also try some of the GABA pain, and then sometimes we give calcium also, because we have a role, calcium has a role in muscular activity also. So these are some of the, and sometimes we take help of a copper also. So just you have to take, you have to try. Otherwise, it is very difficult to treat the case of pharyngeal paralysis.